In a world where disability and discrimination is already tough for those living with certain conditions, what happens when one particular genetic difference turns the victim into a persecuted minority?
Hello and welcome to this week's Africa Today, where we'll be discussing the cultural, economic and social impact of albinism in Africa and finding out just what problems people with the condition face on a daily basis.
We will be looking into the illegal body part hunting industry, which leaves albinos in Africa hiding within their communities, as well as looking at how international charities are playing a part in providing medical health care to parts of Africa in need.
Today here in the studio, we are also joined by an Iranian dermatologist who is fighting to protect those in Africa who cannot access healthcare easily.
And as usual in the program, we will have the news, and of course, I will read your comments.
So stay tuned.
Albinism in Africa. Albinism is a unique genetic disorder that has clear visual symptoms due to the absence of melanin in the skin, which for persons of Caucasian descent may not be such a problem. However, in Africa, where the majority of people are black, having albinism means that the individual stands out so much more than their peers and hence brings with it a host of social and cultural problems. In fact, in Africa, the chances of being born with albinism are 1 in 4,000, compared to a global average of 1 in 20,000.
The discrimination against albinos goes above and beyond the horrific act of name-calling, with the condition seeing a very dark and hidden reality, which for many albinos in Africa can mean the difference between life and death.
People with albinism are sometimes referred to as ghost people. They're believed to have special magical powers, and witch doctors have taken advantage of some of those beliefs and myths and created an industry around the selling of body parts and basically claiming that body parts from people with albinism have magical powers that's going to bring you wealth and success. And these body parts go for a lot of money, $600 for a small piece of a body part, up to $75,000 for a whole body. So you can imagine how much money witch doctors are making out of this.
The market for body parts of albinos in Africa is so serious that the United Nations has estimated that around 80 people with albinism have been murdered since 2000 in Tanzania alone, raising the question as to how many have been killed and murdered in other African countries. Today we are joined by Stephen Wafula, and he elaborates about the challenges albinos face in Africa.
We persons with albinism face two major challenges that restrict our daily lives. Number one, the challenge with the eyes. Number two, the challenge with the skin. Both of them due to lack of pigmentation, that is the melanin. Pigmentation of the eyes and also of the skin. Persons with albinism also face challenges that come with cultural beliefs, such as myths that persons with albinism are a curse when they are born, or we are ghosts.
The sad fact is that when one combines the impact of those suffering with cancer due to albinism, on top of the notion that many are being hunted and murdered for the body parts industry, then sadly, around 90% of those suffering with albinism in Africa die before they're 40.
On the skin, persons with albinism, we are prone to cancer when we expose ourselves too much to the sunlight. The sun rays, they burn our skin, and the sunburns can be cancerous.
Africa is a continent with many developing nations, meaning that many people are living in challenging economic conditions. For those living with albinism or those supporting children with albinism, sometimes the economic burden can become too much, meaning that unfortunately, in some cases, children are abandoned by their parents and left to live on the streets.
For more information, we are joined by Dr. Vanessa Chelimo. She's an African dermatologist who works with albinos. Welcome to our program, Dr. Vanessa. Apart from albinos' lives being at risk, albinos also face discrimination in the society, such as no access to education or even being rejected by their families. What are the reasons behind this?
In the past a family would, for example, give birth to a child with albinism. Unfortunately, because the family would be an outcast, then they would opt maybe to terminate the life of this child so that they do not become a source of curse within the region.
Thanks for that, Dr. Vanessa. Stay tuned for more.
Education is also a privilege for many in Africa. And with children with albinism requiring special attention and care at school, the cost of providing an education for such individuals can often be insufficient, meaning that once again, financial restrictions leave many albinos unable to ascertain a credible education. In terms of medication, naturally, much like the educational aspect, medication is an expensive commodity, meaning once again, many albinos go without. But economically, even simple things like sunscreen can be too much to afford, with the standard bottle costing 10 times more than the average daily wage.
Their children are left out in the community unattended to. And also when even they go maybe to seek medical care, the medical team probably in those areas do not really understand how to handle these persons with albinism. So they will not give them the necessary advice that they require. A child like that who doesn't go to school, then what is left of them is to just probably fend for themselves and take care of the family property, things like land, take care of animals. So it means that this is a child who will be exposed out in the sun, under the sun for many hours. Over the years, we know that with albinism, the sun accumulation of that damage from the sun over the years will ultimately lead to their skins being vulnerable to developing cancers.
And now joining us here in the studio is Dr. Said Nasser Imadi, dermatologist and an Iranian doctor without borders since 2005. His work has taken him to many African countries where he has played an integral part in treating skin conditions in Africa. Dr. Imadi, welcome to the program today. And first tell us, what made you go to Africa? What was the inspiration?
Yes. First of all, I'm so grateful because of your invitation. And I would like to explain, according to our religion and according to our nation wishes, we believe at any time or anywhere, anyone who call us because of sickness and disease, this is our responsibility to be with them. It might be the city near to Tehran, out of Tehran, at the border of Iran, or it might be out of border in other country like Afghanistan, Iraq, and sometimes it might be another continent. Especially in Kenya, Ghana, Burundi, and different countries in Africa continent.
Thank you, Dr. Imadi. We have more coming back shortly, so stay tuned.
The first albino clinic in Kenya was established in Mbagati District Hospital in Nairobi, and it was named Imam Hussein Albino Skin Clinic in 2012, according to joint research activities between University of Nairobi, Iranian Red Crescent Society, and Tehran University of Medical Sciences in Iran. The main mission of this clinic is medical and psychosocial services, as well as gathering information on all albino patients for better medical and social support in the future.
Now we are back with our guest, Dr. Nasser Imadi, a dermatologist. Dr. Imadi, having worked in Africa as a dermatologist, today's program actually is focusing on the problem of albinos in Africa. What challenges did you face in treating albinism, and what experience did you have in dealing with this great challenge in Africa?
Yes, nice question. I remember on 2008, it was the first facing to albinism in Nairobi. According to some bad idea and opinion, some of albinisms, they kidnapped by kidnapper, and then they killed them and cut all their body and sell it on an expensive amount to some of people.
Witchcraft,
Yes, but you know, just by this idea, a part of albinos case or people, it can treat some special disease and complicated disease, like heart problem, kidney problem, liver problem. So as a result of that, just can you imagine all the case of albinos, they couldn't go out. So one side, the problem is skin cancer.
Yeah.
The other side, if they go out, they
They're
might
scared.
be, yes, kidnapped by the kidnapper. So what will happen to them? Either might be killed by kidnapper, or they might die because of skin cancer. So according to this problem, we try to make an announcement to all the people and the government. So this is the serious problem among your albinos case.
Yeah.
And they need a special care and services. So finally, we try to open a clinic for albinos patient every Friday on Nairobi Bagathi Hospital. And after that, because of our try and effort, the deputy of Ministry of Health of Kenya, for appreciation, they opened a clinic with the name of Imam Hussein alayhi salam in Nairobi at Bagathi Hospital.
And now, as usual, in this segment of our program, we'll be having news and events from across Africa. What do you have today for us, Sheila?
Thank you, Hania. This week we have the good and the bad, but mostly the good. To start us off, Isuzu East Africa returned to the Tanzanian market after a 3-year hiatus. The Egyptian firm Al Mansour Auto East Africa was appointed as its authorized distributor. Potential customers will now be able to purchase the brand new cars from Dar es Salaam. Now, still on Tanzania, Sunny New Laser unearthed yet another Tanzanite stone. It is the third time that the small-scale miner has found this precious stone, weighing around 14 pounds. As with the stones before, Laser sold it to the government of Tanzania and urged other miners not to give up on their quest. He also encouraged all miners to overcome the temptation of selling their findings to smugglers, but follow legal protocols to uplift their economy. Now also, an automobile farm in Ethiopia, Marathon Motor Engineering, is set to finalize on the assembly of electric cars. The cars are said to be cost-effective and environment-friendly. The government reduced tax on new cars from 50% to 30% to encourage buyers and at the same time reduce on the imports of old cars. Now, in a sad state of events, the government of Mauritius declared an environmental emergency. A grounded ship from Japan leaked tons of fuel off the southeast coast of the nation, critically endangering the ecosystem. France and Japan dispatched help, joining volunteers who are making makeshift barriers to contain the spread. Now, the Nama and Ovaherero communities of Namibia have expressed unhappiness over the handling of the genocide issue by the Namibian government. The genocide in Namibia claimed the life of 100,000 Namibians by Germany in the early 1900s. They say that the Geingob administration lacked the political capacity or will to negotiate on their behalf. Germany had previously acknowledged moral responsibility for the killings, but no official apology for the massacres was made to avoid compensation claims. Now on to wildlife. The wildebeest migration carried on as usual in the Serengeti. Few spectators were in attendance owing to the COVID-19 lockdown, but not all was lost as local tourists shared videos of their experiences. Let's catch a glimpse of this spectacle, shall we? We have come to the end of this part. Check out our social media pages to stay updated on the latest news and our weekly episodes. Please don't go away. We have more lined up for you. Now we are We're back in the studio with our guest, Dr. Sayed Nasser Emadi, dermatologist and an Iranian doctor without borders since 2005. Thanks for staying with us. Well, as mentioned, part of your mission in Africa was to train African doctors in the field of dermatology. What were some of the challenges that you experienced in Africa, and also what did you do to overcome such challenges?
Of course, it was a very nice question. See, one of the biggest problem in Africa is the less amount of dermatologists. See, for example, in Burundi, just we had only one dermatologist. And can you imagine a country with 11 million people population, how they can be served by one dermatologist? Every day we had the class for all medical students and medical practitioners to teach them how they have to expose to the patient who has skin and how they can put a step on a diagnosis and finally how they can treat them. See, the main skin problem, it was among HIV/AIDS patients. And this was so important for me because skin and a skin condition is one of the most important signs in HIV and AIDS.
Yes.
And what we can do for HIV and AIDS patients. See, if you be able to find out what is the first sign of HIV and AIDS, absolutely you would be able to treat patient at the earliest time.
Yeah.
See, and then the disease cannot transfer to other people.
Yes.
It is important. So we tried to do this one, and we had a lot of class for all medical students every day in Burundi, Kenya, Ghana, and we get a good result of this activity.
That is very
Okay, now still on that, Dr. Imadi, as you have said, you had training programs for medical students in Africa and medical practitioners in Africa. Now, what plans do you have to ensure that this program is sustainable and it continues and to impact positively on the lives of people in Africa?
Of course. See, one of the program is every year approximately 1 up to 2 months I'm in Africa.
Okay.
To continue and to proceed our work in
good.
different countries like Burundi, Kenya. This is the first option.
Yeah.
And the second option, whenever I am in Tehran, Iran or other country, still we have a correlation with our people, our doctor in Africa country.
Different NGOs around the world play an important role in aiding and assisting African medical causes. NGOs such as Médecins Sans Frontières, Red Cross, and Oxfam provide life-saving medical care. To most of the patients, these NGOs are their only hope of being cured. Also, the training given to the healthcare staff in the African continent assures well-trained and experienced doctors ready to take the lead.
One such NGO, Mercy Ships, brings services in the treatment of diseases in the lowest deciles of the population. Hundreds of thousands of patients in Africa have been treated. Dr. Vanessa, how has the Iranian Red Crescent Society helped people in Kenya?
I have met the Iranian Crescent for a while. I've known them for over 10 years. And the services that they are offering to the community is commendable. Why I say so, one, their services are affordable and they are able to reach the all social status of persons in the community.
Now, apart from skin diseases, there are major challenges facing African health services when it comes to other illnesses. Coming back to Stephen Wafula, in your opinion, are African medical healthcare workers receiving adequate training to be able to act independently after foreign NGOs have left?
Iranian doctors in Kenya are doing an incredible job in ensuring that persons with albinism who come across them are screened for cancer, and also they are given prescriptions when they get lesions, and even recommend for surgeries for persons with albinism.
The problem in Africa extends far beyond just one condition. For example, albinism. Generally, Healthcare is something that still needs a lot of time and resources in order to bring countries like Burundi, Rwanda, and a host of others up to the standards seen across other continents and nations in the world.
Fortunately, there are people who care, as we have seen with the case of Dr. Imadi, who is working with a host of NGOs attempting to improve the lives of others. The question that remains to be asked, however, is simple. Why are African nations unable to fully develop their own healthcare systems without the reliance on external partners and donor agencies in order to take care of their sick?
Okay, thank you, Dr. Imadi, for accepting our invitation. Thank you for the work you're doing in Africa, touching the lives of the needy and those who are sick. We appreciate so much on behalf of our African viewers and our African people.
My pleasure, my pleasure. Thank you, thank you.
Thanks a lot, and we hope and look forward to seeing you more in Africa and actually expanding to more African countries and touching the hearts and lives and souls of people in Africa.
Of course.
And I think it's a great way to link the great civilizations of Africa and Iran,
of course,
which have actually historical ties. Thank you.
Yeah, you're most welcome. Just at the end of our meeting, our communication, I would like to say, you know, whatever we did in Africa continent, just if I go to categorize it, the first one, it was my responsibility as a human being, as a medical doctor. And the second one, when I am going to do humanitarian work, to other people who are around me, they will learn, and also they can be effective among other people.
Yes.
So they go to other places to serve other needy and sick people. And the third one, with the mutual collaboration, we can exchange our knowledge. See, I have some information of disease in Asia, and they, the other doctor in Africa continent, they might have some information about the skin disease among black people.
Yeah.
Then we would be able to exchange it, and then we can improve the health among all the society.
Thank you very much.
Thank you, most welcome.
Thank you so much. Thanks for staying tuned. In this segment, we're going to look into what you, our viewers, had to say. We had at SPL stating, chocolate's great, but exploiting farmers isn't. Agree? Give cocoa farmers a real living income they deserve. We also had at Friends of the Earth Ghana stating, if chocolate companies paid a fair wage to cocoa farmers, they wouldn't need to rescue children because cocoa farmers would have the means to hire adult labor and create jobs. We also had at Divine Chocolate stating, smallholder farmers provide 80% of our food but struggle to sustain themselves and their families. Hashtag cocoa farmers. We also had at James Thatch stating, the world celebrates chocolate but forgets cocoa farmers. We also had at Raphael stating, we all have a stake in making the lives of cocoa farmers a better and more sustainable one. Now that's all for today. Thanks for the comments. Please feel free to interact with us on our platforms. Give us your thoughts on the program and also what you would like us to air. Thank you for being with us.
That's just about all the time we had for you on this episode of Africa Today. We hope that you have enjoyed the show.
Don't forget you can share your thoughts on this topic by joining us on Twitter by using our handle at Real Africa Today. We'd love to hear from you.
Thanks for watching Africa Today. And until next time, goodbye from me, Mubarak Kenya.
And on behalf of myself, Sheila Nelima, and the entire team, goodbye and see you again soon.